but don't, it's not just with your legislators. There's other ways that you can speak out and be a service. And you talk about it so much, you're talking about your community service. And what I've learned, and I ask for you, I'll just share this with you. I've learned how valuable it is to volunteer in the community. I'm president of the local American Diabetes Association. They're very unique because physician is president for medicine, but the chairman of the board is a non-physician, and that's sort of their bylaws. And he's a banker. What he's taught me, what I've taught him, the value of that. I think you got to volunteer, but it's not just to go out there and sit and shake your head and, you know, be pretty. It's one thing to sit on the sidelines and be a doctor. It's another thing to do what Dave Hoff's doing. He's part of that. He's part of them. He's one of their coaches. I bet you they call him coach. So that's what I'm talking. When you've got to volunteer and go out there and be part of your community. They need you. I was at a United Way meeting the other day. They wanted a meeting to talk about what they could do. They had some money and they wanted to know where to spend it. Well, they were going to start to do disease state stuff. And I said, wait a second. And they had to focus on elderly people. And I said, why don't we, from my perspective, because what they wanted to do, because they had me there because I knew I had this great diabetes registry and I could tell how many patients, you know, or goal for A1C, LDL, had this and that, you know, they liked all that. And I said, look, if you want to talk about what elderly people need right now, it's how they can find resources. How can they find resources in the community? That's where you need them help. Where can they get medications to reduce price? Where can they find out about nutrition? In fact, I said, why don't we talk to the local, our big grocery store down there called Publix. I don't know what, here it's Kroger or what have you, but it's Publix. So why don't we get the CEO of Publix and talk to him? They have 1 million people per year go through Publix just in this one county where we are. Don't you think it could do a lot of education, a lot of telling them about how to use resources just as they go through there? In fact, I went and talked to the CEO later. He said, that's a great idea, because he sees that as a way for him to do his community service. So you are leaders, and you can influence a community with doing things like that. So don't doubt that, but see that. Now, you can't be, you know, I know you're in practice. I know you guys have got a big agenda, but why not pick one organization? American Diabetes Association, American Heart, United Way, American Lung. They want physicians. Usually what they get, American Lung gets a pulmonologist. ADA gets the endocrinologist. Well, yeah, they're good and they're important, but they have a different perspective than we do. Like when I was at the United Way meeting and they said, well, you know, here's the diseases. We got these people with all this heart disease, but they're also got lung disease and lung cancer. I wonder what the association is. And I thought they'd know. They didn't. I said, it's tobacco. Oh. That's the type of advice. Yeah, but I think the value, you as a primary care, they thought they had to get a cardiologist and a pulmonologist to explain it. But I think, shame on us. We're allowing them to think that. We're allowing them to think that specialists are the only way to go. Now, of course, I think, unfortunately, specialists tell them that too. But shame on us if we don't tell them what we can also do with that. I want to talk about data. You know, Deming was the great quality guru. And what he said, in God we trust, everybody else bring data. Now think about that. Now I want to challenge every one of you, and Danny and I were discussing this, and don't tell me your electronic health records do this, they don't. You've heard of health grades. You've heard of bridges to access. Well, health grades, I looked online. Do you know Akron City is one of the top 50 in the country in health grades? And you go on there and look, and you can look at your infection rate. They also, you know, if you're in Minnesota, you can look on health grades and look up the name of a physician. You find out how many of their patients are goal for A1C, you know, less than 7, LDL less than 100, blood pressure less than 130/80. How many are goal for all three at the same time? How many of you can tell me that? But don't tell me you can find out. I know you can find out if you get in, like Dave was telling me that I can get on, I can go on my computer. No, I want you, do you know it immediately? Because if you don't, if it's not transparent and right there, I challenge the residency, and I said this to John, I said to Dick, every one of your residents right now, I should be able to say, now, how many of your diabetic patients you have? How many of them are goal for A1C? How many are greater than 9? How many don't have a foot exam? And have you and your staff gotten together and created a team-based solution for addressing that? And you know why I'm asking you to do that? Because if you don't do it now, they won't do it when they go out and practice. And that's what Dave told me. Dave told me his physicians don't care. Well, we haven't made it part of their culture. We have to make measurement part of the culture. Berwick, who's now the head of CMS. Now and that was a big political thing because it had to be a presidential appointment. And that, to me, it's not that. Berwick has done some great stuff in looking at quality. There's a book called Best Practices written by, I think it's Kelly's the author, talks about Berwick. And what Berwick did when he showed people their data, he was showing a group of pediatricians, and the one pediatrician crumpled up her data and threw it at him. That's because I think we're not used to looking at data, except when the insurance companies say you're an outlier. I am not an outlier. I understand that, but why don't we start creating that? Why don't we create people who that's their culture? Don't make it part of the quality assurance committee. Make it part of everything that you do. I think it's coming. The medical home says there's got to be transparency. You got to look at data. You got to choose 3 diseases. Diabetes is beautiful because there really is 3 diseases: hyperlipidemia, hypertension, and hyperglycemia. And there's evidence base. There's got to be evidence basis for that. You've got to show your data. You've got to be willing to share it within a practice and share it with each other. And this is not a must-pass element, but it's going to be pretty soon. It's got to be transparent to the physician patients. Why shouldn't the patient know how well you do? You know, I just recently had a colonoscopy. You know how I chose my doctor to do it? My primary care doctor didn't do it. She sent me to, did you notice that? I had a lady primary care doctor. She sent me, that's because my wife said, I'm sick and tired of going to all these damn men. You made me go to men for this many years. We're going to now go to ladies. Fine, that's great. But how did I choose? How would you choose the person to do your thing? I called and I asked, I want to know their polypectomy rate. I want to know, because the one that's more aggressive at looking at polyps, some updates are needed there. Just when I'm starting about getting my polyps taken care of. Well, I wanted one that had the best polypectomy. Well, they had 2 of them that were up at the top. And he would find an average of 6 polyps per colonoscopy. Well, I have a bad family history. My poor father had rectal bleeding. And for 4 years, he kept getting colonoscopies. They found nothing. All right, and I was scared to death. It wasn't until somebody really felt down his right lower quadrant